the first area we're going to sort of talk about is the quality department. So these are the people who are responsible for measuring and monitoring HEDIS compliance. They're developing processes and policies and so on. And their area of expertise that we see is that they're really good at coordinating with providers. You know, they're involved with doing retrospective chart reviews, and they do serve a multitude of tasks. It's not just quality for HEDIS, but there's overlap into STARS and P4P if you're in an area where there's a P4P program. And oftentimes the challenge that we see for risk adjustment is that the quality people are sort of the recipients of the work that's already been done. So their involvement comes in after the fact. So, you know, there could have been maybe some quality measures or some STARS measures that could have been impacted had they known to do some sort of outreach, but because they come in after the fact, their ability to impact is really limited. And so the opportunities that we see with risk adjustment is helping engage them earlier in the process during the data collection year. And it may include coming up with your own metrics or new goals. So maybe your focus is the breast cancer screening. You want to increase that by 10% this year. And so having a goal like that during the course of the year is important, because at the end of the year, when your collection period is locked down, your universe is locked down, then you're left with working with what you have. But if you have a line of sight into that earlier in the game, you are in numbers when the universe is locked, you'll have much more robust data to work from. So here's another area that we see that has the ability to influence risk adjustment. So, you know, we're calling this the member or patient engagement department. And so, you know, oftentimes these are the frontline people. They're promoting the company by having conversations with members or providers where they're doing some sort of outreach to ensure compliance and satisfaction. So they really do have a critical role for all organizations. You know, these are the folks that enhance the member experience. So if you're doing surveys, member satisfaction surveys, it's the work that these people do that help influence those survey results. And really, their strength really is they're the face of your organization. And so we need to understand what their roles are and their challenges and how we can support them so that in turn they support your risk adjustment initiatives. And the challenges that oftentimes these people are faced with, especially in Medicaid populations, is the member movement. So sometimes they'll have bad addresses or phone numbers if they're doing outreach. You know, it's a challenge for them to try and get to the right member or right provider if the data isn't accurate. And so that is a challenge. And again, the opportunity for risk adjustment is they do have the ability to influence patient behavior. So, for example, if you have a diabetes program and you've got members who are outreaching folks to get them enrolled in your program, these are people that you can tap into for other areas. You know, maybe you are focused on breast cancer screening, or you're focused on closing gaps for COPD. So, you know, this is oftentimes an untapped area for a health plan in getting assistance. So now we come to the finance department. And so sometimes these are the people we love to hate because they don't give us the funding that we think we need to have. But we have to recognize that revenue is not a dirty word. In order for every organization to be able to provide the services, it must be adequately funded. And for health plans to enhance their benefits, you have to have the funding. In the competitive landscape that we have today in healthcare, the way plans and providers compete is by benefits. in their benefit design. So finance does play a critical role in this. And their strengths really are managing expenses and developing strategies to help departments attain their objectives for the company. And their challenges are oftentimes they're the last people to know about impacts to models, if there's a financial change that's happening in terms of risk adjustment or final payments. And so having them involved in the process can sometimes help you gain support for investment in future endeavors. So if you can demonstrate a good ROI, if we do this one particular initiative, you know, they become the gatekeeper and they can be the influencer to help support your organization or your department to get that funding. So having them involved from the get-go, again, is key. So now we have provider relations and contracting. Every organization does have people who are responsible for this particular task. Their role really is to help manage the relationship to ensure that reimbursement methodology is sound and that it's adequate and correct. And these are the people who, whether you're from a physician group or you're from a health plan, can influence the providers that they work with. You know, if a medical group has a robust reimbursement program and there's some sort of incentives for the doctors, then you know there's a increased possibility of developing and having a better relationship with those doctors. If you're the plan and you're developing some sort of percent of premium reimbursement methodology or some other incentives, having this person be that voice of your organization, again, enhances that relationship. And the next bullet, collaboration. Collaboration is key in everything that we do. And whether it's here in the office where you work every day or it's at home, collaboration is what makes things work. And ultimately, it's the revenue. We want to make sure as an industry, everybody gets paid adequately. And again, the provider relations people, they can influence us. In the challenge category, you know, oftentimes it's contentious between a health plan and a physician group, and it doesn't necessarily need to be like that. You know, providers often think that they're being underpaid, or providers think they're underpaid, payers may think that they're being overpaid, or there might be some question whether the provider is being reimbursed appropriately. So the big opportunity here for risk adjustment is to create that transparency and the line of sight into the payment changes and forecasts. So again, if your providers know what your initiatives are, where your focus is, if it's on low-performing physicians or low-performing provider groups, having transparency into what the data reveals and sharing that information, it creates a big opportunity to have impact. Lastly, technology. So these are the people that we want to make them our best friends because their roles impact everything that we do in an organization. So whether it's how income data is handled, how do you handle data internally within your own systems, and how is data being delivered to the next entity in line. So if you're the provider group, your relationship with your EDI vendor or your health plan that you're delivering that data to, or if you're the plan, the data that you get coming in from those EDI vendors or those contracted providers, how you handle it inside that plan, then how do you get that data to your health plan? So they have a key role in this area, and they're very good at managing data because that is what their job is. But the challenges here in this new electronic world we have today is that all you need is one thing to break, and it can impact everything downstream. If for some reason there's an edit that's being applied at the front door and data might be rejected, and if nobody knows about that or nobody's working those rejects, then that means that data is lost. And so having a seat at the table with the IT department helps you have these kinds of conversations. And you can see the visual that's there on the right side of the screen. So this is our sort of description of how the world works in healthcare. I'm not going to go over each one of these, but you can see there's many, many handoffs in the process. And so each step in the process we want to make sure is being handled the way we think they're being handled. And if there's any issues, we have the ability to address them and resolve them.